Everyone. Today we are talking about the generally unwell child and the red flags that you need to look out for when your child or your baby is sick. And I have the absolute pleasure of being joined today by Dr. Laura Sumners, who is a Paediatric Emergency Physician. And my name is Sarah Hunstead. I am a Paediatric Nurse, mum of two gorgeous girls, author of A Life, a Finger, a Pea Up a Nose, and I'm also lucky enough to be founder of CPR Kids. And what we do at CPR Kids is we empower parents and families with the life-saving skills of baby and child first aid. And before we go any further, what I'd love you to do is that if you could just give me a thumbs up or a wave just to make sure that all the technology is working well, that would be fantastic. But what I would love to do is hand over to Laura so you can introduce yourself. Tell everybody who you are.
Great. Thank you so much, Sarah, and thank you for having me today. As you said, my name's Laura Sumners. You may notice from my accent that I'm not initially from Australia, so I did grow up in the UK, which is why I went to medical school, and we moved to Australia, to Queensland in 2009, as most Brits do, for a year, and 11 years later, here we are. So whilst over here, I found my love for working with kids, and I've trained as a general paediatrician and a Paediatric Emergency Physician. I am also mother of two boys, so we can talk about the differences and the challenges there.
Yes.
And I'm very excited. So at the moment, I'm working in a public children's emergency, but I'm also one of the members of Cub Care, which is soon to go live, and which will be doing urgent paediatric consults via telehealth in the evening. And it's very exciting.
Fantastic. So I just think that Cub Care is such an unbelievable initiative to be able to have access to a paediatrician after hours via telehealth is something that, as a parent, I was a bit lucky working in an ED. I was able just to pick up the phone, but not all of us have that luxury. So being able to do that, I think, is just a fabulous initiative. So I'm really, really happy to have you guys on, being able to share some of your incredible knowledge that you have. So today we're going to be talking about the unwell child. We're going to be going through the red flags in particular that you need to look out for when your child is unwell, because sometimes as parents it can be really tricky. We always say that you need to trust your gut when it comes to your child's health, but sometimes, especially if you're a bit sleep deprived, you've been wondering all day, do I need to see a doctor? Do I need to go to ED? Things are getting a bit worse now, but I can't quite put my finger on it. What do we really need to look out for? So, Laura, can you just step us through what you think the most important things to look out for, perhaps starting with the history of how your child's been unwell?
Yeah, definitely, Sarah. And I think it is really important to acknowledge that parental concern, and if you do just have that really gut feeling that something's not right, actually to follow that. And I've definitely, someone very wise told me earlier in my career, trust nurses and parents, and I've followed that, and I think it's done me pretty well so far. So in the history, I think there's two things that I was going to kind of talk about, that how I would split it up in the things that worry us. So one is the symptoms, and it depends what's causing your child to be unwell. I suppose the common thing, so vomiting, kids vomit for every reason under the sun pretty much. They might be pain, excitement, but when they're unwell, vomiting, the odd vomit is okay, but if someone's vomiting lots and they're not able to keep anything down, then that's concerning. Probably diarrhea, actually, to me, is sometimes even more concerning, especially if they're a younger child, so especially probably under 6 months old, having very large output diarrhea. So, we talk about number threes, they're pouring out of the nappy, just watery, and you can't tell if they're wee in there or not. And it's just, and you're getting through the washing machine going all the time. And that to me is quite worrying.
I think one of the things with disposable nappies too is that they can be quite absorbent. So really being aware of how many nappies they are actually going through as well, because it can be, just hidden that little bit as well.
Yeah, and we talk about, talk to our junior doctors about actually, children don't have a big volume for what their weight is. So, definitely worrying about that. Fever, I wouldn't say that fever in itself is a red flag. I think fever to me tells me that your child's got an infection. It doesn't tell us, is it a bacteria, a virus, or where it's coming from. In a fever in a child under 3 months definitely very concerning, and they need to have an urgent medical review.
Yes.
If they have had a fever for over 5 days, then that's also, that you really need to start going, if they got anything that, what is happening. And if they're immunocompromised, if they're on any medicines that affect their immunity, or, in all honesty, someone who's not immunized is at a higher risk of serious infections. But fever in itself is a big talk, and, we won't dwell on that too much today.
We'll do that next week, okay?
Yes.
Yeah.
And then, other symptoms they can have. So, cough and runny nose, they're very common, but are they having difficulty with their breathing? And I'll talk a little bit about that later on. A seizure, their behavior, is that unchanged? Are they irritable? They, crying, difficult to settle. Kids can often be, when they're unwell, miserable, but actually, they just want to be clinging to you, and your arms are aching. But it's the, hang on, I can't even settle them. They're crying all the time. That's, to me, that's worrying.
And that's really interesting, because one of the things, certainly when I was working at triage many, many moons ago, was that when a parent would come in and say, I can't settle my child, there's something not right, I don't know what else is going on, that was a really big red flag. So we need to remember that it is certainly a behaviour change that perhaps you might notice first in your child. One of my friends, actually, her child, when she was 2.5 months old, had meningitis. And the one thing that she noticed was that her child, who normally slept or went down reasonably easily, was crying when she put her down, and she couldn't console her. And that was why she took her to the hospital. That, and that she wasn't feeding as well. So it wasn't that she had a fever. It wasn't that she noticed anything else medical. It was the behaviour that changed.
Yeah, and that's really important. Yeah. And then I suppose symptom-wise, we talk about severe headache. Have they got, they don't like the lights, that makes their headache worse. Is their neck stiff? Are they not moving their head around? And it depends on the age, and it can be quite challenging in children. And the younger children can't tell us all of this. And then, are they limping? Are they not moving part of their body? And then the other way I wanted to talk about was the activities of daily living, and you've just touched on that really well. And I think one of the, and again, it depends what age. So babies don't do a huge amount. They feed, they wee, they poo, and they sleep. And so are they doing what they normally do on a given day? Are they feeding as much as normal? Are they, not interested in the breast or bottle? Are they really sleepy, or are they the opposite? Are they just irritable and they just won't settle? Are they having good wet nappies? Are they going to toilet as much as possible? And, are their poos normal? And then and as they get older, they can, their behaviour will change. So are they playing with you? Are they interacting normally? Are they confused? I'd say, if they're confused and they, don't seem to know who you are, then that would be worrying. And yes, that kind of irritability, or really sleepy. So, we talk about, are they difficult to wake up, would be worrying.
Yeah, absolutely. And I've actually had that experience myself with my 2 girls, where they were both sick. They were both unwell. My older one, I was finding her really difficult to rouse. She was laying on the couch. I was actually having to wake her and sit her up to have sips of fluid. Otherwise, nothing was going in.
Yeah.
I realised that she hadn't weed in about 12 hours. And, and then she would just lay back down and go straight back to sleep. Whereas my younger one, she was sitting up there, she was eating like the electrolyte ice blocks, that you can get, the rehydration fluid ice blocks, asking for more Peppa Pig, because it was Peppa Pig at the time, for her. And she was alert, she was interactive. And the interesting thing was, and I'm sure we'll talk about this next time when we do fever, was that the little one who was alert and interactive, she had quite a high fever. It was above 40 degrees Celsius, whereas the other one, she had a temperature of just over 38. And so I think that really highlights that we shouldn't just be looking at the number, that we really need to be looking at that behaviour of our children. So I actually took my oldest daughter to hospital, where she was admitted.
Oh, good. I'm glad you.
Yes.
I'm glad.
Oh no, she got to go there. Yep. And so she went to hospital and was admitted for an infection and needed intravenous antibiotics. The other one, she had the same bug and needed oral antibiotics, but was much more well. So it's interesting how looking for these signs and symptoms that you are talking about is really, really important, because if we look at that story, she wasn't drinking, she was really sleepy, and she wasn't weaning. So there are those signs again that we need to worry about.
Yeah, and I think you're completely right. And I can honestly tell you, I don't own a thermometer, so I'm sure that shocks many parents at work when I tell them that. I don't have one. I look at how my kids are.
I don't think that's a bad thing at all. And as a side note, I read this really interesting study that I think they must have had a little bit too much time on their hands. But what it was seeing if parents were able to tell simply by touching their child on the torso whether they could tell whether their child had a fever or not. And it was something like 99 something of them knew just by touching their child because they felt hot.
Yeah, so, and it's just looking at the whole child and seeing how they are, Okay.
So you mentioned breathing problems as well. What do we actually need to look out for when it comes to breathing problems in a child?
So I suppose, how I break it up. So there's anatomically, you've got your upper airway, which is this bit up here, and then you've got your lower airways, which is your lungs. And the most common, so I suppose things when you have problems in your upper airway, it's noisy breathing when you breathe in. So we call that stridor, is the word we use in medicine, but that can indicate that there might be some swelling or some blockage up there. And so children, and especially gets worse when they're upset. So the most common thing that we see that causes that is croup, which is a virus that causes swelling of the vocal cords. And those kids, and I'm not the best at this, but apparently I can do this, is they do a and it's a really loud, harsh noise inwards.
That wasn't bad. It was pretty good.
I do a better wheeze. And then when you get to your lower airways, often it's more when they breathe out. And with that, they might have signs, and I suppose this is moving on to examination, which is, what I was going to talk about next, is that they can have signs that they're having to use their extra muscles because they're having to work harder. For some reason, there's some narrowing there, whether there's some mucus or infection. And so that's normally a breathing out noise. So we call, the medical word is a wheeze, and that's a it's a bit like the kind of, heavy smoker going up a hill maybe kind of noise. And they often, they suck under their ribs. They can be breathing really fast. They can suck in under here, this little bit here. So they sort of do that there, and, can be really struggling to breathe and not able to talk, and not able to feed and not able to sleep. And often these things are a lot worse at night. And, I think there are a lot of parents there who sit with them all night worrying and can't, about them, and come in the morning and you go, you poor things, you're absolutely exhausted. This child hasn't been able to breathe all night. And, so they're probably the main key things to watch out for. And I think if a child has those signs, then that's a definite reason to call an ambulance. And I, don't infrequently say to parents, and I think people don't like to call an ambulance. They feel that, they're taking it from someone else, or, it's ingrained that, oh no, we don't need to do that. And I would actually say if a child does have that sign, do call an ambulance, because, so I say, one, the ambulance officers can actually do things. They can give medicines and make your child better. And the other thing is, you don't want to be driving with a sick kid in the back. You're stressing about them. The last thing is, you have an accident or something, because you're worrying about driving with your child sick. So, I actually think, for me, I feel like it's my job to empower people to say, no, you actually can call an ambulance, and that is completely appropriate.
Yes, and we're going to turn this into mummy confessions right now. I'm going to tell you a story.
Oh, don't ask me about my parenting moments.
Yeah, so this is mummy confessions. No judgment-free zone. Okay.
Yep.
So my oldest suffered from she had bronchiolitis a lot when she was a baby, and she also had asthma, which she has since grown out of, as many children do. And when she had bronchiolitis for the first time, knew she was unwell. She had mild, what we call increased work of breathing. So she was showing mild signs of this. So I put my nurse hat on, which was stupid. I should have put my mum hat on. And I looked at her and I thought, yep, okay, she needs to be seen by a doctor. I'm going to take her up to the hospital, but I'm going to pop her in the car because I don't think we need an ambulance yet. And so I popped her in the back of the car, and in hindsight, I think it was probably an okay decision at that time because she wasn't, she was still alert, she was still making noise, she was doing all the right things, she wasn't struggling too much. But while we were driving, something happened and she became very, very sick in the back of the car. Very, very sick, to the point where she actually became quite floppy and she changed colour. So in hindsight, we realised that she had some mucus stuck, and so I needed to pull the car over. I grabbed her out of her car seat and I immediately called an ambulance. So sometimes things can actually get worse really quickly, and so we need to make sure that we are continually safe. And if you need to stop because things change, you stop and you get an ambulance no matter where you are. That's really important. We're only about 3 minutes away from the hospital, but I couldn't have kept driving with the way that she was.
Wow, that must have been quite stressful.
Oh, it was. Yeah, she was fine. She ended up clearing this herself, but Anyway, please keep going. What would you like to talk about next?
Okay. So I suppose we've moved on to examination. So we've talked about. So I like to use a structured approach, and I talk to families about this when we're in ED and we, talk about things to come back for. So we talk about, we do our A, B, C, D, E. We're very simple in medicine. We need to, follow the alphabet. So A being your airway. So we talked about the noisy breathing, often breathing in, if they're really struggling to breathe with that. And I'd also say if they can't swallow or if they're having excessive drawling. Obviously, some kids, when they're teething, like mine, poor. But especially if they're unwell and they can't swallow or anything, then that's worrying. And then moving down to the breathing. So as we talked about the struggling to breathe, are they breathing really fast? Are they using extra muscles? They're just not breathing normally for them. And then, so next would be circulation. So that's kind of to do with your blood pumping around the body. And, we talk about like how do their hands and feet feel? Are they really cold and they're just not right? When you look at their fingers and you touch at the end, is it pink? Does the blood flow come back well? You can often feel in children, especially when they do have a fever, you can feel their heart racing. Is their heart racing really, really fast? Or, also concerning, is their heart, that's, feels quite slow. And these are really difficult things to explain because even for lots of doctors, because children have different normal heart rate, breathing rate and stuff as per their age. So when a normal breathing rate for a baby would maybe anything up to about 60, whereas for a 10-year-old it would be like an adult, so about 10 to 15. So I think just knowing what their normal is and are they are they at their normal?
Exactly.
So I'm trying not to complicate it too much. But
is it different to normal? I think that's a great way of explaining it, whereas you don't need to know the exact number. You don't need to know this, but you know what is normal for your child. You know your child better than anyone. If it is different to their normal, that's when you need to be concerned.
Yeah. Exactly. But definitely, if they're really pale and they feel really cold and we talk about just feel shut down and they don't look right, their colour, then that's a very concerning. And again, that would be a red flag, call an ambulance. And then probably, so D is for disability, which is really to do with their level of alertness. And I would say anything less than, them being alert, looking around, sort of knowing who you are. It can be challenging because often when children have a fever, so when they have a higher temperature, they can feel awful, they can be really miserable, they can be lethargic, their breathing rate, their heart rate goes up, everything goes up. And then, the fever comes down and then half an hour later, they're running around and you go, is that same child that, and we know that. And I think, it's really important to recognize. And, often parents come in and they say, I was really, really worried. And now I can't believe now I'm wasting your time. And we say, no, not at all. Like things change. And in pediatrics, really, we use time and observation are probably our biggest investigation. We don't go running in and doing blood tests and things like that. We watch them. And, if their temperature comes down and they look better, then we go, great. And we, they look, that's fever related. If they don't, then we get more worried. And I think that's the same for, but they can look really quite unwell when they've got a fever. That, does get people really concerned. And I think, again, people, if they are concerned, they don't need to feel bad about getting a medical review.
Exactly. It's not up to it, guys. It's not up to you as parents. You don't have to diagnose anything. We don't want you to diagnose anything.
No.
That we'll be out of the job if that happens. Let's leave that to the paediatricians, to the experts. That's really important. Your job is simply to recognise that something is not right, and that's a really important thing. Certainly, sometimes something that really resonated to me when you were talking about circulation or the colour, so those cold hands and feet, that paleness as well, and something that certainly I've seen in my own kids and in kids that I've looked after in the hospital, is that another one of those signs too is what we call being mottled. So, and I think a really nice way to explain that I apologise to all the vegetarians out there, but you know those big fat Italian sausages at the butcher's that have got all of that lovely fat all through them, and they look kind of all marbled? That would be absolutely delicious if you're not a vegetarian. But that kind of splotchy colour can be really concerning as well. Mind you, some kids are normally like that, but once again, different to normal. And it's also looking at the circumstances around it. Certainly my children, if they jump in a really cold pool, will go mottled and blue, but their breathing is fine. So, it's about looking at what's happening around them as well.
Yeah, I love that description. I've never heard that one before, but
it is. It's something that is different to normal. And I think that's one of the biggest themes that is coming through here today, is that difference, and to actually trust in yourself that you do know what is normal, because you really do. Absolutely.
So I suppose that's then moved us on to E for exposure, which is, looking at them head to toe. And I haven't really mentioned rash yet, and I think that would be, so again, that would be a talk for another day. It's a very big talk. I think the biggest thing with rashes, and we talk about, do they blanch? So do they go when you press on them? So it's very, very common to have children to have a rash during an illness or even at any other stage. And there's worrying rashes and there's non-worrying rashes. And the worrying rashes for me are the ones that, and they look like a bruise. So they look like a big kind of purple bruise. And when you press, or we talk about the glass test, and you put that on it, it doesn't disappear. And that's a very concerning rash. And that is a pick up the phone, call an ambulance. They need to be seen straight away. And I think that's where we, definitely in children, have a look from head to toe. Is there anything there that you can see?
Absolutely. I think that's really important. And just to elaborate on that glass test again, here's a glass I prepared earlier. That's actually left over from the Facebook Live I did last week. It's got sunscreen on it, but we'll just ignore that, okay? And so literally pressing the glass against the skin, looking through there and seeing, does it disappear? Yeah, exactly.
Yeah, perfect. Yeah.
So, that's important. And I think rashes are something that can really concern parents, to be honest, and carers.
They do. They cause a lot of anxiety, and to health professionals as well,
Yeah. So would you say, even if it is a blanching rash, so that rash that does press on it and it goes away, and your child has fever, is that something that we should sit on at home, or meaning not literally to sit on your child?
Look, I think if you're concerned, you could. I think they still need to be seen, but it's probably less. You can organise to see your GP, or you can give us a call on Cub Care. I think that's the great thing with telehealth now, is that we can, have a look. So I think, as you said, it does cause a lot of worry. And I think, if they've got other symptoms, then definitely get them checked out.
Okay, excellent. I think that is very, very good advice, because the last thing you want to do, you need some sleep. If you're going to be up all night worrying, watching your child breathe, then you just need to get some help. It's that. And
again, I think that's a good question to yourself, isn't it? Are you going to be able to go to sleep tonight, or are you just going to be lying there worrying about your child all night? And if you're going to be worrying about them all night, then I think that tells you, actually, I should get someone to have a look at them.
Yes, absolutely, it is. So what I would love to do is just open up to questions to anyone. So we've got lots of people tuning in today, which is fantastic. So please feel free and tag any friends who you think would benefit from this information as well. But we would love to be able to answer any of your questions. So while we are on live now, so if you're watching this recorded later, sorry, but if you're on live now, please type in the comments below any questions that you do have. Now, I did receive one question earlier through Messenger because of somebody who wasn't able to attend live with us. And one of those questions was, when your child is unwell, and obviously if they're not drinking very much, there's risk of them becoming dehydrated. What kind of fluid should you be giving them? I mean, if they're part of the question was, should you be giving them breast milk, or do you have to give them water, or what else do you need to give them?
So look, I think if you've got a breastfed child, I would keep giving them breast milk. Children have quite a high energy requirement and a high metabolic demand. And actually, Australian kids, they love their water, which when they're eating is fine. But when they're not eating, actually, and it's not, people don't realise this, that it's not a great, they get into a bit of trouble. So especially if someone has vomiting and they're not eating and they're not having any calories or sugar in any other way, and all they're having is water, the theory that we understand is what happens is they start to break down their fat, and part of that is they get a product called ketones, and that makes them feel nauseous, and it's a bit of a self-perpetuating cycle. So some of the emergencies I've worked in, we actually have super dupers, and then that's not a plug for super dupers, but ice poles that have sugar, which kind of, people be going, oh my God, like I never give them those, they go completely crazy, and I don't, they just drink water. But when they're unwell and they're not eating, then this is more, the toddler age than that. But if they're a young, sort of under 6-12 months, I would give them what they, breast milk, formula, or if they're older, cow's milk. So you just need to give them something that's got a bit of substance to it.
Yes, yeah, absolutely.
And obviously you've got like all the rehydration. So as you talked about earlier, there's hydrolyte, gastrolyte, all those that you can go and get. And they do ice poles as well. So it's always worth having a box of those in your freezer. So if your kid does get unwell, you can try them in that. And some like them, some don't. Otherwise, we occasionally try like a little bit of watered down apple juice. Again, stuff that we would never normally give our children because it's so high in sugar. But when they're unwell, that's what actually makes them feel better. And
Yep, absolutely. And I think that's really important that we do recognise that. And that is, well, certainly one of our number one tips is don't have to go up when your child is sick at 9 o'clock at night to go up to the pharmacy to get them. Keep them in your freezer ready to go. That's important. So we do have a couple of questions. Georgia has actually asked about a fever and a rash, which I think you actually answered really nicely, about a fever and a rash that is blanching, that you can make an appointment to see a GP. If your child has a non-blanching rash, then you do need to, that's ambulance and hospital. So I think we've answered that one quite well. So thank you, Georgia, for your question. And Lisa has said, if my child is sick, how many wet nappies isn't enough? When do I need to worry about dehydration and take her to the hospital? So do you have a general...
look, I'd probably say about a third to half of their normal wet nappies. Now, actually, so when children aren't producing as much urine when they're unwell, it's kind of actually a good thing. So their kidneys are doing what they should do. So they're not having as much in. So their kidneys are holding on and saying, right, we need to keep hold of this fluid. And I think it really depends what the illness and what other symptoms. To me, they're much more at risk of getting dehydrated if they have vomiting and diarrhea or they have losses. Yes, when you have a fever, you can lose more from sort of evaporation from your skin. I think if it's more that they've got a sore throat, they're in pain, they don't want to eat or drink as much, but actually they're not having anything, they're not losing fluid in other ways, they're less likely going to develop dehydration, but I would say probably less than half their normal. And it gets tricky when they're having diarrhea and you can't tell and you're like, what is what? Like,
Yep, absolutely. And I guess that if you can't tell, then you need to err on the side of caution and seek medical help. That's important. And another question that was asked as well is, and it just reminded me when you talked about the sore throat, if your child is in pain, so you suspect they have a sore throat or they're achy and so on, are you able to give them some analgesia such as a paracetamol or an ibuprofen to help with pain?
Yes, definitely. And, I think people feel that a child has to have a fever to give those medicines because they see them as an anti-fever medicine. We actually would say the opposite. So if a child has a temperature and they're running around playing and they're happy, I wouldn't give them anything. But, in the same point, they may have a temperature and feel unwell, or they may just be having a really sore throat and then just off their intake, or they might have mouth ulcers. Sorry. We knew the postman was going to turn up, didn't we? Apologies.
Yes. No, all good.
He was under warning. So, I think, definitely, and, so here we go. We talked about proud parenting moments. So when my son was, I think, about 7 months, my second son, who is a lamb, for anyone who's a Maggie Dent fan, the whole rooster lamb thing,
yes.
He definitely was a lamb. And he, for about a day or two, I wasn't sure. He was just a bit more cranky, and I gave him some Nurofen and for a couple of days and he was okay. He didn't have any other symptoms, but just wasn't quite right, but not enough that I was, too worried. And then I got the call from daycare saying, did you know that he's perforated his ear? And he'd obviously had an ear infection and been in pain, and I hadn't, poor thing couldn't explain that to me, and that's why. But yeah, so I think, definitely if they've got pain, and probably one of the most painful things and most miserable children I've ever seen in my career are children with mouth ulcers. So the dreaded hand, foot and mouth, or the herpes, the cold sore virus.
Yes.
Those kids they are in so much pain. And so we, and sometimes to the stage that we do have to bring them into hospital and put a feeding tube down or something because they just will not, they completely outmost refuse to have anything orally.
Yes.
And, occasionally we even have to use oral morphine and things. But, so I think pain is definitely a reason to be giving them, unless there's any other medical reason they can't have those.
Fantastic. Thank you. And of course, always following the directions on the bottle. That's really important. And if you feel that the simple analgesia isn't helping your child, you absolutely need to be seeking medical help. That's really important. Now, 2 more questions before we wrap up this afternoon, because we've hit the half-hour mark and everybody will start falling asleep before. Oh, no, they probably won't actually. You probably want us to keep going. But 2 more questions. So Claire has asked, if my kids keep vomiting and can't keep anything down, at what stage should I take them to the hospital? I'm asking for both a baby and a toddler. And I think that's important that she has asked because it is different for a baby and a toddler, obviously. So how would you answer that one, Laura?
So look, I think the babies are tricky, and I think if you've got a young child who is vomiting and can't keep anything down, I would definitely be getting them up to the hospital. The older child, depends how long it's been going on for. We know that there's those vomiting bugs and they just vomit, and often, they just have a sleep and hopefully, after a few hours they wake and they're okay and it's stopped. But I think if it's been going more than a few hours and they really can't keep, and then again looking at how they are, so like you talked about your daughter, are they lethargic, what's their colour and their perfusion and everything like, and I think if they start to have any of those other signs, then definitely that's a reason to bring them up.
Absolutely. And as you said before, a baby under the age of 6 months who's having more than 1 or 2 vomits does need to be seen because they don't have the reserves that we do as adults, so that's an important thing. And last question, and please forgive me if I mispronounce your name, but Hitachi, and I do apologise if I have mispronounced that, has asked, if my child has a fever and is vomiting, my screen has just flicked up as I have said that. So with fever, how long do I wait before taking them to the hospital? And I think we've probably already answered that it's not just about the fever, it's about looking at your child as a whole. So I think that's probably an important one. But Lee has snuck in a question just before we're about to finish. She's gotten in there. So Lee has said, how long can a cough last after croup? Is there anything I can do during the coughing episodes to help? Now, that is the million-dollar question, I feel. And just for anybody whose child hasn't had croup yet, it is likely that your child will end up with croup at some stage. But I love that description of they sound like a seal. So, you know, that barking cough, that ooh, 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 that really
That's
is
very
just,
good.
well, thank you. It's years of practice. And having it, and I've got a child who I think has got an odd-shaped airway, and she's 10 and still gets croup. So so we've had lots of experience as well. So how long can a cough last with croup, would you expect?
So I suppose being that it's a viral thing, you know, anything up to a couple of weeks really can be normal. Again, cough is a whole different talk.
You know what? Why don't we just do another one on
we can
croup?
on breathing things. The only thing I would say is that if it's a moist cough, so we worry more, and you know, there's lots of different causes about cough, of cough.
Yes.
And a lot of them, you know, some are more benign than others, but a wet cough, so a moist, you know, that really kind of chunky cough, if that's going on for more than probably 4 weeks, that's a reason to see your doctor, and you might need a prolonged course of antibiotics, and potentially may even need to get a referral to see a paediatrician. So I think that dry, annoying cough that just lingers, anything up to a couple of weeks, and I really wish, I would be very rich and be on a desert island if I had was able to come up with anything that would really help.
Exactly.
I think there's a lot of things out there, and unfortunately, I don't think any of them really help. Although I did hear, I was listening to a podcast, and a respiratory physician said about the like menthol on the chest, so like the Yuki Bear and stuff. So you know, that's probably the only thing that helps with a viral cough.
Yeah, absolutely. So we actually did a Facebook Live on this recently, on that you really can't give cough medicine, over-the-counter cough medicines, to children under the age of 6. The Therapeutic Goods Administration clearly says that you can't give cough medicine to children under the age of 6, and that's really important. They don't help, they can have side effects, there's a whole varying reasons why, and there has been some studies out that show that in children over the age of 12 months, that what is even more effective than a cough medicine is a teaspoonful of honey to help soothe that as well, but of course only in children over the age of 12 months because of the risk of infant botulism under there, so that's important. No honey under the age of 12 months, really important. Okay. So Lee and Hitachi have said thank you very much for answering questions as well. And so in summary, everyone, I think we really have touched on a lot of different areas here, because the generally unwell child is, you know, we're talking a subject like this. It's absolutely huge. So Laura, I tell you what, I think you deserve a medal for being able to just kind of squish it down into 30 minutes here. But really, I think some of the areas that you really have highlighted are, number one, trust your instinct. Know what is different to normal. Look at your child, not the number on the thermometer. Are they floppy? Are they lethargic? Have they had a colour change? Do they have breathing problems? Are they feeding not as much as usual? Have they got, you know, less than a third to a half of their wet nappies? Trust your gut, and I think that is really, really important. And before we sign off, is there anything else that you'd like to say to everybody out there, Laura?
No, I hope I've summarised it enough, and I think that is, you know, if you're worried that, you know, I think we would rather see them earlier, and as I say, things change, and I think if they've got any of those red flags, call an ambulance, get to your emergency. If they don't and you're still worried, then I really hope that's where myself and the team at Cub Care can help, because we know, you know, that especially it's hard enough when you've got one child in the evening. Do I take them to ED or not? Throw in more, and the chaos of, you know, and not having family nearby, having recently gone through all of this, you know, but you weren't worried, you want some peace of mind, and I think that's where you either see your GP, get the out of hours GP, or give us a call, and we really hope that we can help people with that.
Absolutely, and that's really important. So everybody jump on over to the Cub Care Facebook page and their Instagram and follow them, and also sign up to, I I'm wondering if, I'm sure you've got a newsletter. I'm sure I saw that on your website so that you can, where I was going,
Probably.
do we? Yes, yes.
I know Chris is doing a lot. There's a lot of work happening.
Yeah, so sign up to that so you can actually find out when launch date is on October. Okay.
Yep.
So Laura, thank you so much for sharing your expertise with us today. So appreciative. And will you come back again? Will you do this again with us?
Yes, definitely.
Good. Excellent. Okay. Thanks so much, everybody. We'll see you again soon.
Okay.